What anatomical challenges face liver transplants? When it comes to liver transplants, there are several anatomical challenges that can impact both the donor and the recipient. Understanding these challenges is crucial for successful outcomes. One of the primary concerns is graft size. The transplanted liver must be large enough to meet the metabolic needs of the recipient. If the graft is too small, it can lead to a condition known as small fore size syndrome. This syndrome can result in graft dysfunction and even failure. This is particularly important in living donor liver transplantation, where only a portion of the donor's liver is used. Surgeons must carefully calculate the graft-to-recipient weight ratio to avoid this issue. Another challenge lies in the complexity of the liver's vascular anatomy. The liver receives blood from the hepatic artery and the portal vein, and it drains through the hepatic veins. However, the anatomy can vary significantly from person to person. Some individuals may have multiple hepatic arteries or unusual branching patterns. These variations complicate the surgical reconstruction process. For instance, if a donor has multiple hepatic arteries, the surgeon must perform meticulous anastomosis to ensure adequate blood flow to the graft. Additionally, issues like portal vein stenosis or thrombosis can arise if the vessels twist or kink during surgery, which can jeopardize the success of the transplant. The biliary anatomy also presents its own set of challenges. The bile ducts are closely related to the portal vein and hepatic artery, making reconstruction difficult. Variations in the size and position of the bile ducts can lead to complications after surgery. Biliary strictures, which are narrowings of the bile ducts, are common post-transplant issues. These can occur due to injury during the donor's liver removal or from devascularization. The more complex the anatomical variations, the higher the risk of biliary complications, which can affect how well the graft functions. In some cases, standard graft types may not be suitable due to the donor's anatomy. For example, if the right or left lobe grafts are not feasible, surgeons may opt for alternative grafts like the right posterior sector graft. However, these alternatives requiring detailed preoperative imaging to understand the relationships between the portal vein, hepatic artery, and bile duct. Certain anatomical configurations may make some graft types unsuitable, complicating the surgical process. Finally, postoperative vascular complications can arise from technical errors during surgery. Issues such as hepatic artery stenosis, hepatic artery thrombosis, or pseudoaneurysms can severely compromise the graft's survival. Portal vein complications, including stenosis and thrombosis, are also significant risks, especially in split liver or pediatric transplants. In summary, the anatomical challenges in liver transplantation are multifaceted. They involve managing complex vascular and biliary structures while ensuring the graft is of adequate size. Successful transplantation relies on detailed preoperative imaging, surgical expertise, and careful selection of both donors and recipients to optimize outcomes and minimize complications. Always consult healthcare professionals for personalized advice regarding liver health and transplantation.